Let's take up the next question. What should the nurse do first when a male client is having tonic-clonic seizures? So as a nurse, it is very common to find a lot of patients developing epilepsy, seizure. So what is a seizure? So you should remember that in our brain is like an electrical transformer. The electrical activity in the brain is organized electrical activity normally. If it become a disorganized electrical activity, all our muscles will start contracting simultaneously, and that is called generalized tonic-clonic seizure. Generalized tonic-clonic seizure. What is meant by tone? What is meant by tone? See, you have a muscle, right? So if you press the muscle, it is not easy, it is not very flabby, it is very tight, right? So that is called tone. Then when the seizure is happening, the muscles are going into an increased tone. And similarly, what is meant by clonus? Clonus is also a typical feature whenever the tone of the muscle happen to increase, hypertonicity occur. So that typically occurs at the time of the seizures. When all muscles are having it, you call it as what? Generalized tonic-clonic seizure. Now, we need to know how are we going to manage this condition. First thing that you need to remember is you need to restrain the client's arms and legs. You need to elevate the head of the bed. You need to put a tongue blade in the client's mouth so that he doesn't bite the tongue. And then you need to prevent the injury. But now the question is, of all these things, which is the first thing you want to do? Most important thing you need to do is you need to prevent injury. If the person falls down from the bed because of the seizures, then he may end up in a fracture. So that is the reason prevention of injury is the first thing you need to do as a nurse, is what you should remember. So let us look into all these important things. First, do not try to stop the person's movements when he is having seizures. Then the time for which these seizures are happening is very important. If they are lasting longer than 5 minutes, or then you need to seek an emergency treatment. More than 5 minutes is too long. Then you move the objects in the surrounding area so that you are preventing the injury. You try to lay the person on the ground, on the floor, and gently turn him onto his side, onto one side. That is the next important thing. And you need to place something which is soft and flat under the head is very important. And you remove any items from the head and anything around the neck, because during the time of the seizure, if that happened to press upon his neck, that can lead to respiratory obstruction. So these are the important things which you should not forget. And don't put anything in the patient's mouth, very important. This is a very common misconception among the people, that put the ring, put the bangle, put a lot of things. No, that's not correct. Do not put anything in the person's mouth, otherwise he can aspirate it. Now, a very important condition, status epilepticus. What is the meaning of status epilepticus? Any seizure lasting more than 4 minutes, or if there are successive seizures without regaining the consciousness, that is the definition of status epilepticus. 4 minutes funda, you should not forget. Any seizure lasting longer than 4 minutes is considered to be status epilepticus. And what are the causes why people go into status epilepticus? Number one, suppose somebody is regularly taking epilepsy medicine. A lot of times they forget to take that. and that can precipitate a status epilepticus. Any infection, meningitis, encephalitis can be a predisposing factor. Any head trauma, if somebody had a head trauma, developed seizures that can last longer than 4 minutes. Any metabolic disorders, alcohol withdrawal, there are the various reasons. So the main things you need to remember about the management is maintain the airway, call the physician, notify the physician, administer oxygen, and if there is any IV medication that he is taking, phenytoin, phenobarbital, anything that he is already taking, you try to monitor the IV medication after the doctor prescribes. Now, post-ictally, when the patient had tonic-clonic seizures, what is meant by ictal? Ictal. Let us be very sure on the terms. Ictal. Ictus means one seizure is called ictus, one episode of seizure. After the seizure, especially generalized tonic-clonic seizures, patient will have confusion, he'll be running around, there can be bedwetting. So in that stage, how is a nurse going to manage? What are the principles? Number one, you observe the behavior of the patient in the post-ictal phase. A lot of times they are sleepy, they are confused, they are combative. They will try to hit the things and they have a difficulty in talking and they don't remember. That's called post-ictal amnesia. They are unable to remember. Then if they are sleepy, try to continue to put them in that side-lying position and protect their airway. Then you need to avoid injury. You need to give reassurance, reorienting. Hey Ramu, nothing will happen to you. Don't worry. You're all right. That reorientation and the reassurance is needed. You need to assess, are there any injuries because of the epilepsy, because of that seizure. Then if you need to closely monitor, as a nurse, you need to closely monitor the post-ictal state. Number one, confusion can last for a few minutes. He may not be able to recognize anybody. He may not know whether it is a day, whether it's a night. So confusion can continue. Then sleepiness can continue for about few minutes to few hours. And nil per orally. Until the patient is unable to swallow, don't give him, otherwise he will aspirate. So nil orally is a very important thing until he is able to swallow properly. And you need to document the entire episode. These are the important things. Post-ictally, the nursing care need to be delivered. Then another important challenge is, if there is a tonic-clonic seizure in a person who is in wheelchair, what are you going to do as a nurse is very important question. So most important thing is, do not remove from the wheelchair unless it is very necessary, because he is already wheelchair bound, and you try to secure the wheelchair properly so that you can prevent him from falling down. You fasten the seat belt so that you prevent him falling down. You protect and support his head, very important. You ensure that he is breathing properly, and you need to put the pad in the wheelchair because the feet are touching that lower iron part. So you try to put a pad underneath to avoid the injury to the limbs, and you follow the seizure first aid protocol. This is the typical thing you need to do when there is a tonic-clonic seizure in the wheelchair.